Hello, this is our group presentation for INFR 4391, Serious Gaming. Our topic is virtual reality in the treatment of acrophobia. I'm Thaidan and Mac will be talking a bit about the demo later. So to start off, the basic problem that we're trying to solve is, well, in the very basic, acrophobia is the irrational fear of heights, and vivo exposure therapy is the most common way to treat that, and a lot of other phobias as well. Um, Treatment can be hard to it can be hard to like set up essentially. It can be hard to find time. It can be hard to pay for. A lot of patients will refuse that therapy out of fear and anxiety because what vivo is basically just living it. So if you're afraid of heights, you will have to like jump from high, presumably onto like a trampoline or something, or at the very least look like face your fears, look over, a railing or something like that. And so it can be hard to like organize that for a lot of places, or looking over like the side of a building. And there's a bit of a safety hazard with real life treatment. Of course, they, take precautions and everything, but you never know. And that's where a lot of the anxiety comes from. The known solutions, basically, other than Vivo, which I just talked about a little bit, virtual reality is the most promising alternative to that, to Vivo. VR results in a lot less anxiety prior to sessions and in follow-up sessions. Um, but you would think that because there's less fear beforehand, there's less fear during. That's not actually the case. It works just as effectively, and it has been researched pretty extensively for as long as VR has really existed, I think, since the 90s. Um, and VR also has a nice benefit that can be shown, or that has been shown, in that it's a game, so it can have game elements like a digital coach, for example. There's one study used one that was voiced by an actual actor, so the delivery could be less like maybe robotic or impersonal, and instead it would be coming from an actor who would feel friendly and approachable, and like they could act the part they needed to act rather than an actual therapist who might not be able to necessarily, or it might just be more intimidating that way. um, our solution is to make a VR serious game, to treat acrophobia. The goal of the game is to fall onto a target, trying to hit the center for more points. Um, Players are able to adjust their height and get progressively higher at their own pace for more points. And if possible, we will use a virtual coach to help players progress as well. That would be something for further down the line. So our solution is viable because of things like the gamified elements. We'll talk about that a little bit during the demo too, but basically like it should make you want to keep playing because it has stuff that's like a game, whereas real life doesn't have points, and it's, you're actually jumping off a thing every time. That can be scary even if you're not like acrophobic, because everybody's somewhat afraid of heights. Even if you're not irrationally afraid of it, it can still be a scary thing in real life, whereas it might not be so much in VR. Um, but treating in VR still works. Like it's not really at a disadvantage in that it's still very effective, just as much as Vivo, and sometimes more than Vivo treatment is, as a lot of studies have shown over the years. Um, it actually seems like VR is even more effective when the world doesn't feel completely realistic. So there was one study that found someone left because it was too realistic. They were too afraid to do it. And there's studies where less people showed up before the tests, and then like less people showed up for the test and for with Vivo, and more people showed up for the VR ones. So people are more willing to do it. And on top of that, it's cheaper and easier to organize than Vivo treatment. So you just have to develop the digital scene, which, like, unlike a real scene, as I was kind of just talking about, it doesn't feel so realistic, so it's not so scary, and you don't have to make it amazing. Like, it doesn't have to be amazing and realistic. It kind of shouldn't be, otherwise it can scare people. And even though it's cheaper, it can still be more effective because you can have a coach and stuff like that. And it can be cheaper to develop than developing a real place to do it. And it's just cheaper to use too because you just buy it and then you have it forever. Unless it's like a subscription thing. But even then, it can be cheaper than a physical place and you don't have to travel there or anything like that. So now is time for our demo.
Hi, this is a presentation on our game. So if we press begin, basically, as you can see, press space to jump and land on the target. So basically the entire game is going to be played. You just keep putting the people who are trying to get over their fear of heights by making them fall through heights, starting at, as you can see, it's not that high right now. And it'll progressively get higher the more the player lands on the target. This is to slowly help them get used to higher and higher heights, which should help them get over their acrophobia. So just to show what happens, so you press space and your character jumps down, and then you press space and you jump down again. And you can see that the height is slowly getting higher, but it's very gradual to not freak out the player. This is to help them get used to the height, like make them get used to heights and also stay focused on falling rather than getting a shock value of like, oh crap, I'm suddenly all like super high. So the game is pretty simple. But it keeps getting higher just to make the player more and more used to falling from heights. And as long as they keep hitting the target, then they'll progress to a higher height. The game is simple, but it doesn't have to be complicated because it is meant to just make the player get used to heights, like help them with their acrophobia by making them concentrate on just trying to land on the target rather than how high they are and how far they're falling.
So for future work in like this field, we need to implement VR into the game, as you saw, and update some of the environment. Basically, what we have now is basic falling. Like you can fall and move and land on something, and there's some stuff like the little smoke particles that are when you're falling, or like not smoke, I guess, like it looks like stuff is speeding by you. That doesn't have to change too much. It could be updated to look a little more not blocky, but it's still good the way it is. Um, but like the target needs to be more like specific and points need to be in there so that you can want to keep playing to do better. Um, but other than that, there's not too much to do because it shouldn't look too realistic. Otherwise, it'll be scary. So it's a nice, easy project we can make. And then that's really it. So here's our references. Yeah, thank you for listening.